If you've been dealing with back pain, leg numbness, or heavy weakness when walking, you may think it's just a normal part of getting older. But what if it's something more serious? At first, it might seem like minor discomfort, but over time, simple activities like standing in line, walking through the grocery store, or even getting out of bed can become a struggle. The symptoms creep up slowly, making them easy to dismiss until they're impossible to ignore. If you're over 50, there's one condition you must watch out for: spinal stenosis. Welcome to Living with Spinal Stenosis. I'm your host, Miss No More Back Pain. Today, we're diving into the symptoms to learn why people over 50 must recognize the warning signs of spinal stenosis. I'll break down the early warning signs of lumbar spinal stenosis, why symptoms get worse over time, and the red flags you should never ignore. Before we get started, I want to make it clear that I am not a doctor and this video is not medical advice. I'm sharing my personal experience with lumbar spinal stenosis to raise awareness and help others who may be going through the same thing. If you're experiencing back pain, please consult a licensed healthcare professional to get a proper diagnosis and treatment plan that's right for you. My mission is to provide care, community awareness, resources, and empowerment so that those living with spinal stenosis feel supported, informed, and empowered on their journey. Your journey. You are not alone. We can navigate this together. Leave your experiences in the comments. Let's get started. If this type of content is important to you, don't forget to comment, like, and subscribe. Early lumbar spinal stenosis may have no symptoms at all, but in most people, the condition develops slowly over time. Initially, you might experience mild back pain that gradually intensifies into a burning sensation radiating into your buttocks and down your legs, much like sciatica. As the narrowing of the spinal canal progresses, you may also notice numbness, tingling, cramping, or weakness in your legs, along with a loss of sensation in your feet. In some cases, there can be a noticeable weakness in one foot, causing it to slap down when you walk, a condition known as foot drop. Additionally, in more advanced cases, pressure on the nerves in the lumbar region can lead to a cluster of severe symptoms known as cauda equina syndrome. As symptoms become more noticeable, these are examples of things you may begin to experience. You may begin to experience pain radiating down your legs, like sciatica symptoms, but it's coming from your lower back. It presents itself as a burning, electric-like sensation that shoots down your legs from your lower back into your buttocks and in your legs. Mine presents itself mostly in my lower back and in my inner right knee. I usually get a buzzing sensation right here in my inner right knee. Also, the buzzing sensation from my lower back down to my buttocks. You can feel it in a straight line as it buzzes down the back of your leg. Often you will begin to feel weakness in your legs as if they are going to just give out on you. You might feel like your legs are going to buckle on you unexpectedly. So simple tasks like standing at the sink to do dishes can become uncomfortable. As it progresses, you may need to lean forward when sitting or standing. You may need to use a shopping cart to lean forward on it to get relief. In my instance, I find myself often moving into different positions from time to time because it becomes unbearable. So I may sit on the edge of a seat and sort of lean over, or you may find, you might see me constantly moving around in my seat because I just can't stay in some positions too long. So I'll move around a lot. You would think that the sitting position is the least active position, so you would be okay. In my case, doing repetitive work in the sitting position is how this developed for me. And so, of course, it's one of my worst positions. When I go to get up from the sitting position, I'm very stiff. My legs from my waist down are all swollen. I have problems with my walking at that point, and my nerve activity has increased. Have you ever found yourself needing to lean forward when walking or standing? Have you ever found yourself instinctively leaning over a shopping cart, kitchen counter, or even a cane just to relieve the pressure on your back? That's your body trying to create space in your spine to ease the nerve compression. This happens because the nerves in your lumbar spine are being squeezed tighter as the spinal canal narrows. The more compressed they become, the harder it is for the signals to travel from your brain to your leg, leading to pain, weakness, and difficulty moving. For me, I started to make excuses to avoid walking long distances. Grocery store trips became shorter, and I started to look for places to sit down wherever possible. If this sounds familiar, let me know in the comments. Have you noticed these changes in your daily life? Red flags. Imagine walking across your living room and suddenly your legs feel like they might give out. You feel unsteady, like you might collapse. This kind of unexpected, severe weakness isn't just fatigue. It could mean that the nerves controlling your leg muscles are being severely compressed. If you notice your legs failing or struggling to support you, it's time to seek medical attention. If you suddenly can't control your bladder or bowels, or if you feel like you have to go but can't, this could indicate cauda equina syndrome, a rare but life-altering condition caused by severe nerve compression at the base of your spine. If this happens, go to the emergency room immediately. Pain that radiates down your leg, often called sciatica-like pain, is common with spinal stenosis. If your pain no longer comes and goes, but instead persists or worsens dramatically, don't ignore it. What makes spinal stenosis progress? Several factors contribute to why spinal stenosis doesn't just go away or make it worse. 1. Ongoing wear and tear. Every step, every moment puts stress on your spine. Over time, the discs between your vertebrae lose hydration and height, which further narrows the space between your nerves. 2. Bone spurs and arthritis. Your body tries to fix the problem by forming extra bone called bone spurs, but this actually makes things get worse by pressing on the nerves even more. 3. Thickened ligaments. The ligaments in your spine can stiffen and thicken, encroaching on the already limited space in your spinal canal. 4. Inflammation and nerve irritation. Chronic inflammation around the nerves can lead to persistent pain and nerve dysfunction, making everyday movements more difficult. 5. Muscle weakness and deconditioning. As pain increases, many people become less active, which causes the muscles supporting the spine to weaken. This lack of support puts even more strain on the spine, accelerating the cycle of pain and dysfunction. Catching symptoms early and making the right lifestyle changes, like targeted exercise, I would recommend walking, physical therapy, and proper posture adjustments. I would recommend chiropractic. That's my opinion. I am not a doctor. This is not medical advice. can slow down the progression and improve quality of life. The earlier you take action, the more control you have over how spinal stenosis impacts you. Understanding these symptoms early can help you make informed decisions and take steps to manage your condition before it becomes debilitating. If any of this sounds familiar to you, this is why raising awareness about spinal stenosis matters. It's not just about back pain. Take it from Miss No More Back Pain. It's about how it changes your mobility, your independence, and the way you navigate daily life. Let's talk about it. Share your experiences in the comments. Let's support each other on this journey. Click this video next. When work hurts, the hidden link between your 9-to-5 job and spinal stenosis.